Good
Great.
morning, everyone. My name is Kristy Dellacroce. I'm the co-host of Stronger Than Lipedema. Along with me today is Miss Brandi, the admin of Lipedema Chats and Lipedema Strong Her Connections. We are absolutely honored here to have Dr. Georgiou or Dr. G on with us today. We truly appreciate your time and your expertise, and thank you so much for being here. Brandi, do you want to kick things off for us with some questions?
Yes, we're so excited to have Dr. G. He is from Greece, right?
Uh,
Cyprus,
but
but it
it
happens often that the two are confused. Thank you both, first of all, for having me, and it's a real pleasure to be here. Yes, absolutely. So it is obvious that you have a passion for helping women with lipedema. How did you end up choosing lipedema as your specialty?
So I think I always knew that I wanted to go into plastic surgery since even before entering medical school. But during my training in plastic surgery, I came across my first lipedema patient. This was back in 2015, I think. Unfortunately, probably up to this day, we don't get taught a lot about lipedema in university even. So it was a bit of a, I would say, a shock for me that so many patients are affected by this, but I didn't really know a lot about it up until 2015. And so I came across this patient, and I remember examining her, and just touching her to examine her was quite sensitive and quite painful, and that struck me quite a bit. So I think that was the first experience that I had with lipedema, and since then, I think I've been getting more and more into the subject of lipedema, to currently being almost exclusively with lipedema patients.
That's amazing. Yeah, we appreciate the surgeons that go into that as a specialty, so because we
Yeah.
need it. So, what about your credentials? You mentioned that you have been treating patients since 2015. So, can you just walk us through your different credentials?
Sure. So I did my medical studies at the Charles University in Prague, but I went to Germany for my medical specialization in plastic reconstructive and aesthetic surgery. I started in Hanover through Berlin and ended up in Potsdam under Professor Gotz. I'm probably aware of Professor Gotz. He's one of the gurus in lipedema and lipedema reduction surgery. I was very lucky to train under him. So I've been treating patients since then. During my time there, I was able to see many different techniques in regards to lipedema reduction surgery, and I was able to get experience in PAL, WAL, and decide for myself what I think is best. Since 2 years now, I've been back to Cyprus. I'm originally Cypriot, and after finishing my medical specialization and working as a senior consultant under Professor Gotz, in 2023, I moved back to Cyprus to start my own practice. And since then, I've been the director of plastic reconstructive and aesthetic surgery at the German Medical Institute in Limassol, Cyprus, where we deal with a lot of lipedema patients. And not only that, we do a lot of reconstructive breast surgery, reconstruction also after skin cancer. So we do have a wide spectrum. But I would say now, at the moment, the majority of my time is spent with lipedema reduction surgery.
Great.
Okay, this is always a sticky subject here, but I know that it happens. But have you personally ever turned a patient away? And if so, why or what alternatives did you offer her?
Sure. So the way I usually do things is once a patient contacts me to have a consultation, I send out a standardized questionnaire that helps me quite a bit with setting the diagnosis or confirming the diagnosis if the patient already has the diagnosis. And we have a consultation, usually over Zoom, to discuss the questionnaire and all the medical information. The first step, always in lipedema, the first treatment is always the conservative approach. So you do need to go through a period of conservative treatment, which is primarily with compression garments, maintenance of a healthy nutrition, a healthy physical activity level. So these are always paramount, even before surgery, because the way to maintain the effect of lipedema reduction surgery after the operation itself is the continuation of this measure. So I am quite strict on this. So I've had cases where the patient was either unwilling or unable to perform the conservative therapy. In those cases, I recommended giving it another 3 months, another 6 months, where we could do another consultation to see where we are at, and then decide if it was a proper timing for lipedema reduction surgery. So it's not every patient that comes to me for a consultation that I immediately set the indication. It's really a case-by-case decision, discussing the pros and cons with the patient, and they do need to be aware of the whole process. Of course, liposuction, lipedema reduction surgery, it is a low complication rate procedure, but there are still risks involved, and patient does need to understand the whole process and what that entails. It shouldn't be seen as simply going away for liposuction. It's not that. It's aesthetic liposuction versus functional liposuction are two completely different things. And patient really needs to be aware of what that means. And if I feel that the recovery period, the postoperative instructions will not be followed, then I would advise the patient to give it a bit more thought and reconsult with me in a few months' time.
Is there a specific diet that you think helps lipedema more than others that you found for your patients?
A specific type, a specific technique?
Of diet. You mentioned
Diet, yeah. So yeah, that's very, very important question. So we always like to work with evidence-based medicine. That means that there's been research on something that's been published on peer-reviewed journals. Unfortunately, at the moment, there's no universally accepted lipedema diet. The latest publication that I read was on low-carb diet, that it does seem to help most. And how I usually work, I really love getting feedback from my patients. So I always ask patients about their opinion, about their experience. And most of my patients have been giving me positive feedback when it comes to low carb diet, anti-inflammatory diet, ketogenic diet. So I feel this is the path that the evidence is leading us to, but there's no one specific diet that works for all. I usually recommend, if a patient, like especially advanced stage patient, has been struggling for many years with obesity as well, I usually advise them on seeking the advice of a nutritionist. And it's not like a nutritionist has the answers for all patients, but at least having someone following up on you and tweaking the nutrition according to your needs and measures, I think that's quite helpful. And it really does take a team to treat lipedema. So this nutrition, of course, is a big part of that as well.
I agree, for sure. Yeah, it kind of needed an accountability, a partner, and to hold you accountable, they have the little check-ins.
Sure.
So you mentioned when you were training, you were exposed to several techniques, the wall PAL.
Sure.
What do you use, and do you offer that in conjunction with skin tightening?
Sure. So as I mentioned, during my time in Germany under Professor Gortz, I was very lucky in that I trained also not only in PAL, power-assisted liposuction, for those that are not aware of the nomenclature, and WAL, water jet-assisted liposuction. So at least in my experience and in my hands, I found PAL to be better. I felt the post-op recovery was easier for patients. I felt the bruising was less for patients. I found it was less traumatic, at least in my hands. That does not mean, though, that lipedema surgeons performing WAL, I think, are inferior. It's definitely not. I think it's just using the technique that you are most comfortable with to achieve the best results that you can achieve. So I think you can achieve good results with both. The important thing is that you find a lipedema reduction surgeon that is trained enough with the technique that they are using to get good results. And in regards to skin tightening, I just want to make a small distinction here. Many times when we're saying skin tightening, we mean the minimally invasive techniques such as either Morpheus8, BodyTite, Renuvion, J-Plasma. I do perform Renuvion, J-Plasma. I find that at the moment, at least, that's the most powerful minimally invasive technique for skin tightening, and I can perform that during the lipedema reduction surgery as well. I usually do a combination of techniques of Vaser, PAL, and Renuvion, but this is mostly kept for early stage 1, stage 2 patients. Due to my experience working in a specialized lipedema center back in Germany, I think my name was also quite associated with advanced stages, stage 3 patients. And in those cases, usually you're not going to be offering the patient Renuvion J plasma, the best tightening technique that you could. I think in those cases, at least a skin excess removal surgery needs to be discussed. And of course, being a board certified plastic surgeon, this is something that I can offer to my patients as well.
Well, very nicely. So you can do the skin tightening or you can do the lift. And can you
Exactly.
explain, you mentioned Vaser. Can you like define that a little bit more and how you would use that and what that does for women?
Sure. So going back to my time in Germany, we're mostly using PAL and WAL. After moving back to Cyprus, I found that the demand for skin tightening patients here are much more demanding. I think it's because living in a warm climate, patients are wearing shorter clothes, and this led me to looking for alternatives when it comes to skin tightening. So Vaser is an ultrasound-based liposuction. It sort of emulsifies fat, let's say melts the fat, and then you use a kind of assisted device to actually remove the fat. In my case, power-assisted liposuction. So the combination of Vaser together with the Renuvion, I find, again, at least in my experience, the most powerful, minimally invasive technique to achieve a nice skin tightening. And this is what I offer most of my patients as well.
Yeah, I mean, it makes sense, especially with the lipedema and the fat nodules, right? It probably helps a little bit
Exactly.
more. Yeah.
Exactly. And that's why I very rarely, you're probably already aware of the manual extraction technique.
Mhm.
So using just PAL or just WAL, I think it is necessary in several cases to perform the manual extraction technique, making a slightly bigger incision to sort of push the nodules out. With Vaser, I don't have that necessity very often because I find that Vaser is able to go through that nodules and I can remove them through the power-assisted liposuction.
Nice.
That's amazing.
It
Yeah.
really is. And then what body areas do you treat?
I do treat really the entire surface of the body. So strictly speaking, the definition of lipedema to this day is happening on the extremities. I think at some point the definition will change, but still definition is disproportionate fat accumulation on the extremities of affected patients. Having said that, of course, I have a huge number of patients that says, I feel the nodules, not just on the legs or the arms, I feel it also on the lower abdomen. I feel it on the back of my neck. I feel it on the under my chin. So even though still the definition does not include these areas, I find that performing similar techniques to what I use on the legs and the arms does reduce the symptoms there as well.
Yeah.
So I can reduce nodules in those areas as well. I can perform also many patients, of course, we do start with the functional treatment, which is removing the fat, the lipedema fat, the debulking surgery, which is primarily a functional surgery. But I find the more we go along with our treatment plan, we're dealing with young female patients in many cases. So the aesthetics, of course, are very important as well.
Yeah.
So I find the more we go along our treatment plan, the aesthetics come more into focus. So I have a lot of patients that are interested in getting breast lift or breast reduction as well. And this is something that we can offer here at the GMI as well.
That's nice that you have a combination.
That's awesome. Yeah. How do you like to break up your surgeries? I know some surgeons will do the front of the legs first and then the back, or the lowers first and
Sure,
the uppers. How do you
sure,
divide those?
sure. Again, I think it's not one wrong technique or bad technique. I think it's just doing what you are taught or what your experience is. As I said, I come from Professor Groth's school of thought, so I do the front of the legs first,
Okay.
which means going all the way from the groin down to the ankle. Of course, you can get a bit of the saddlebags in that as well. The easiest way for me to explain which areas get treated, because that's one of the most common questions, is I ask the patient while they're at home to just lie on their back on their bed and just by patting on the front of the leg with the hand, they can basically every area that they can feel. That's what I'm going to be doing with the fronts of the legs. And then I usually wait 3 months between surgeries on the same body area. And then after 3 months, I would be doing the backs of the legs. And backs of the legs very, very often also includes the buttocks and the lower back, depending on the preference of the patient as well.
Great. I love that you explain that you can tell by laying down, because sometimes it's hard to visualize. Okay, what does that
Yeah,
mean, and what areas are
exactly.
treated? That's a great.
So yeah, having international patients, of course, can create some tricky situations. I mean, having a virtual consultation might create some difficulties in explaining the whole process to the patient. So you do need to find ways to explain it in layman's terms so that the patient can really understand and feel comfortable and confident flying all over the world just for this surgery, which is, of course, a great responsibility for us. But you do need to be able to explain to the patient in the best way possible.
Absolutely. That's wonderful. How many nights are your patients required to stay in the hospital after their surgery?
So I usually keep my patients at least 3 nights in the hospital. It's not like the patients strictly, especially early stages, they need medical care, but I do find it's much more comfortable being here with the nursing staff, taking care of them and changing the bed sheets for them, helping them out with the compression garments, helping them out with going to the toilet and showering. So it's a minimum of 3 days, but we do offer also longer stays. We do have a package also for 5 days. I've had even a patient stay for 7 nights because she's a POTS patient, so it basically means that she was having difficulties with mobilization right after surgery. So we didn't want to take any risks, so we arranged for her to stay 7 days here, and she was having her daily MLD, manual lymphatic drainage, from our trained physiotherapists here, and so it really does. You do need to discuss this with the patient to find what is best in her case.
That's terrific. Yeah, a lot of us have POTS, a lot. That's a common thing that a lot of us
Exactly.
have. I do. So that would have been really
Yeah,
nice. Yeah.
exactly. So I find that finally we're getting a bit more recognition of comorbidities in lipedema, what we haven't really been having the last year. So a lot of patients I'm seeing with POTS, a lot of patients with Ehlers-Danlos syndrome, PCOS. So there's definitely many comorbidities that are going unrecognized, but I think the more we are raising awareness, of course, the great work that you both are doing is great because it's helping raise awareness and bring patients and surgeons together. That's definitely going to increase the knowledge and the skills that we have to move forward with this disease.
That was funny. Brandy and I were just talking about the comorbidities, and I feel like, every day it's like, man, another one, another one, another one.
Yeah,
And
It's a
I'm
lot.
surprised.
yeah,
I'm like, and I'm still here. I'm still living, and
yeah,
so
yeah.
it is possible.
Yeah, so you are right. It can seem very daunting and very scary, and many young patients that their first contact is they just hear about the word lipedema. They go onto Google, they Google lipedema, and they see advanced cases, and they're very anxious about it. And they read it's progressive, and they read about the comorbidities. I think it's explaining the whole process, explaining that yes, it might not strictly speaking be curable, but it's manageable, and through proper therapy, you can have a great symptom reduction and maintenance of this effect. So I think awareness, knowledge on lipedema, it's really essential to be able to explain all this to the patient and take away all the stress that they're having.
Yeah, I mean, I agree. I was that patient because I looked at it and I saw the progression. And so I was stage 1 headed into 2. I thought automatically that I was going to go right to the very
Exactly.
end.
Exactly.
And, being younger and being, in the fitness industry, I was just like, what? Like, no way, this can't happen. So again, the awareness is key, and to bring education to these clients who automatically think they're going to progress there, because it's not the case. Um, Okay, so let's see. So you can keep patients kind of long as you see fit. You kept the one patient with POTS for the 7 days.
Of
What
course.
about coming in? How soon do you want your patients traveling from the US or another country?
So I say that the latest they should be in Cyprus should be the morning time of the day before surgery. So I've had a couple of cases even last week of a patient from Australia. She had a cancellation of her flights. She lost her cat, but it was a whole thing. So she arrived basically 9 p.m. the day before surgery, and this creates a lot of stress for the patient. This is what I want to avoid. I'm a big believer in positive mentality and to having a nice recovery. So I think taking it as stress-free as possible is very, very important. And that's why I recommend all my patients being in Cyprus the morning time, the day before surgery at the latest.
Yeah, I can see that being stressful, especially, flying really far.
Exactly.
Especially
And
if
you,
you're coming
you
from Arizona.
Sure.
Exactly.
And you're having the swelling because of the long flight, and sometimes baggage gets lost or you're not sure where you have to go. So the earlier the better. Of course, I understand there's logistics involved. This means time usually away from your work, away from your friends, from your family. So I do appreciate that. That's why I also offer my patients, I will give all my patients my personal WhatsApp number. I try to stay as much in contact with them as possible, because even for logistics, sometimes hands-on approach is needed, and I think that's been my whole approach from day one.
Yeah, no, I totally agree, because it's, even for some women that might not travel out of the country, it becomes,
Sure,
stressful. So having your number, I think is great.
sure, sure.
Right. Hey, you know what? While we're on the subject of flying a long time, this is a throw-in question, but we've recently had a great question in the group. A lady asked about what we should be doing to prevent blood clots on these long flights when we fly for
Sure,
surgery.
sure. That's a really great question. So how I usually do it, I'm super cautious when it comes to blood clots.
Okay.
So during, of course, post-op, we begin 6 hours post-op with antithrombosis injections. On the third day or on discharge day, the patient receives like a goodie bag, a medication bag with all the medication that they will be needing for the post-operative period, which also includes antithrombosis injections. And these are for to last them for 2 weeks. So yeah, so I want the patient again not to need to go to the pharmacy, not to be stressed out. Is my GP gonna help me? Am I gonna be able to get this back home? So you receive everything that you will need during your stay. And the way I do it is I have the patients perform the injections, or some of the staff perform the injections for them until the flight day. So the day of the flight, they do one injection, and then they do the next one the day after the flight, so that they're covered with that. Still, as I said, I'm very, very cautious with that. So I ask the patients, even during the flight, to be keeping moving their feet as much as possible while sitting. This activates the muscle pump, so we avoid blood clots with that way as well. Getting up and walking up and down the aisle every 1 or 2 hours is also a great idea to activate the muscle pump. Other patients have said they have booked extra leg room during the flight. Other patients, of course, this is also sometimes a financial question, but some patients have booked a business class primarily when they're flying back, which also helps with having more space. Other patients have preferred to break the long flight into two parts. So if you're flying through London or Qatar or wherever, they choose to stay like a night there before undertaking the next flight. So I think these are the most important measures. And of course, staying very, very well hydrated, drinking lots of water. this is sometimes forgotten a bit when it comes to blood clot prevention. But this is the easiest thing that the patient can do to avoid blood clots, staying well hydrated, drinking 3 liters of water a day. That's a great way to avoid a blood clot.
Great.
And do you recommend that the patients travel or come alone for surgery?
So again, it's not every patient that is able to fly with a loved one. I would say most of my patients at the moment are flying solo. In those cases, what I recommend is to prefer to stay at a hotel instead of an apartment after surgery. Many patients choose Airbnbs, for example. The issue with that is that we cannot be sure that you have like bottles of water and or food even. So if you're traveling solo, I would recommend staying at a hotel where all this is taken care of for you. But even patients that are traveling solo and they are concerned about being alone, we also have nursing services, nurses that can visit you at your hotel even after discharge. So this was actually done after a request from a patient about a year ago. And to this day, no one has actually needed nursing services. So I
Wow.
think I think it does give you like a safety blanket, let's say, like having a safety line, knowing that it's there if I need it, it's good. But to this day, no one has really needed it. I think the reason is because no one will discharge you from the hospital if either myself or the patient is not 100% sure that they can cope back at their hotel or Airbnb. And I think if you keep this, plus the fact that my physiotherapy team is visiting them daily in any case at the hotel for the MLD, I think that having someone from my team visit you daily, have a look at everything, help you with the incisions, help you with the wound care, help you with the compression garments and perform the MLD, and just being in constant communication with myself, I think that gives you like a safety that is very important for recovery as well.
I agree. Yeah. I think you're actually one of the first doctors that we've heard that kind of have the team come in and check in on their patients and everything.
Yeah.
That's really
So,
nice.
and I know it's just me here giving the presentation, but really here it's teamwork all the way. I wouldn't be able to do a fraction of what I do here with the number of patients that I do if I had a great team around me. Of course, I'm the one responsible for the pre and post-op and the surgery. I do all the steps myself. I do both sides myself because that was a question. How can you be sure about the symmetry if two surgeons are working on a patient? But even though I do have an assistant with me during the surgery, Dr. Yolanda, also a board certified plastic surgeon, it's me performing the actual liposuction on both sides. So I can be sure about the symmetry. So Dr. Yolanda is a great part of my team. Without her help, I wouldn't be able to do this. The physiotherapy team, Christos, Marilena, the passion that they have for their work is I don't think I found physiotherapists that are more passionate about what they do than them, and the rest of the physiotherapy team as well. The residents on the ward that are responsible for taking care of the medication and the discharge notes and stuff like that. So it's definitely a teamwork to achieve what we do here.
That's amazing. And I love the tip about if you're traveling alone to stay in a hotel. It's the first time I'm thinking about that because not only could you do the room service and have the amenities and facilities, but if you had an emergency, you could just call the front desk and say, "Hey, I've had surgery.
I need help.
Yeah, I need an ambulance," and at least somebody sort of knows that.
Exactly. And again, I can't take credit for that. I'm in contact, in constant talks always with my patients. This, for example, the idea of trying to get patients traveling solo to stay at a hotel was actually an idea from a past patient of mine. So I think just keeping up with your patients and listening to their feedback and always improving, that's really important. They've built, my patients have built like a support network. They have a WhatsApp group that everyone enters once they've had a booked in date with me. And the questions that I've been getting since they started that WhatsApp group has decreased substantially because they're just discussing with each other and just solving each other's problems. And Of course, still, my input is always very important as well. But I think bringing patients into contact with each other helps alleviate a lot of the stress that one might have before surgery.
That is amazing. That is a great resource.
Mhm.
Absolutely. So, okay, we already covered that you're located in Cyprus and people come from all over the world to see you. So that's no issue. Do you have a price range that you could give us on your, because we know we'll be asked. That's always the first question.
Sure. No, it's important to be aware of the prices. The first thing that I started was I wanted to pay the patient that chooses to come from abroad for us to know, okay, this is the price that I'm paying, and that's it. So we call it lipedema package, so that the patient knows that in this price, the hospital stays included, the anesthesia, the surgery for myself, the pre and post op, the medication for after discharge, so that they know they don't have any hidden costs, because of course they need to calculate and be ready for everything. So the standard price, which is for 3 nights, is €6,500 for fronts of the legs or backs of the legs. Having stage 1 and stage 2 patients, sometimes a 360 liposuction. So doing both the fronts and the backs in one go is possible. And in that case, of course, we do need to increase the price a bit because it takes substantially longer. You need to turn the patient over during surgery, which also adds a bit to the surgical time. So in that case, it's usually around €9,000 for the front and the leg and the back together. But again, it's every case different, and you do need to discuss this with the patient beforehand. So yes, starting price, let's say, or standard lipedema reduction surgery is €6,500.
That's amazing. That's great. And I'm so glad that you touched on the fact that it is possible if you're early stage 1 or 2 to do it in one surgery, because we have a lot of stage 1 and 2 gals in our group, and to be able to knock all your legs out in one surgery would be really amazing. That's wonderful.
Sure. Yeah, that's definitely helpful from the logistic point of view. The patient does need to be aware that the recovery from a 360 liposuction is a bit more protracted. It takes a bit longer. So in those cases, I do recommend the patient staying just a bit longer in Cyprus so that I can be personally responsible for the immediate post-op care. But yeah, definitely doable in early stage patients.
That's amazing. Well, thank you, Dr. G, for being with us today. If someone would like more information or to get a consult with you, what's the best way to do that?
So either through my website, through the contact form, or through my email or my social media.
Perfect. And we will have all that linked with the when we post this in our group. So that's wonderful.
Yeah, we
That's
can
great.
tag you and bring more awareness to, just having alternatives versus the US, because we know that the prices continue to rise here. And insurance obviously is still very difficult because we don't have an ICD-10 code. Dr. Herbst, I'm sure you've heard of her.
Of course.
She's working so hard to make
I
that
know.
happen for us. And she's
I know.
right there,
I know.
So I think that will
Uh,
help, and I think that'll
for
make it
sure.
a little bit easier, for insurances to not combat us so much. But
Uh,
that's why we want to
yeah.
just offer lots of resources, because it financially wise, it's women just can't afford to have it here.
I know, and it's a real shame that the countries such as the States, with such advanced medicine, patients need to travel abroad for surgery. I fully agree with that. I'm of course, very appreciative of all the great work that many lipedema researchers are doing, such as Dr. Herbst, of course. I was again very lucky being part of Dr. Gott's team, that we were part of a multicentric study, LIPLEG. I don't know if you're aware of that, being the largest center in this study in Potsdam and Bad Belzig. Basically, we were comparing the surgical route against the conservative route. And the hope is that once the data of this study, hopefully by the end of this year and beginning of next year, are published, we will be able to show the positives of lipedema reduction surgery. And this is not just to induct lipedema reduction surgery in the general healthcare system of Germany, but it will have worldwide indication. So I'm really very optimistic about the outlook when it comes to lipedema reduction surgery, but of course, I'm very, very happy to accommodate to any patient that is interested as here.
Yeah.
Terrific.
Again, thank you so much. We really
Great.
appreciate all your knowledge and your expertise for the community.
Yes. And your time. Thank you so much.
Thank you for having me. It was a pleasure.